We've got a lot of people out there think the one big beautiful bill doesn't affect them negatively, but I'm going to tell you, if you're receiving Medicaid, it's going to affect you. If you're receiving Medicare, it's going to affect you. If you're receiving the Affordable Care Act, it's going to affect you. If you're receiving health insurance from your private work or you're paying for it yourself somehow, it's going to affect you. So we're going to go into all this today, and please prove me wrong on any of these points, but I'm going to go through the entire list of exactly what's going to happen. This is also a live Q&A. If you've got any immediate comments, make sure you type them into the chat there. If you're watching this on a recording later, type them into the comments, and I'll be more than happy to make a follow-up on any of your questions. Okay, you're going to pay more. That's across the board. So the big beautiful bill, the new magic spell in politics is fraud, waste, and abuse. Anytime politicians say fraud, waste, and abuse, we let them do whatever they want. So this is what happened in the big beautiful bill. They kept saying over and over and over, their target is those people on Medicaid, the lazy gamers, the 26-year-olds that are sitting in their kids' basements, playing video games. Okay, all right, so that's the target. So they're going to target fraud, waste, and abuse. And what actually happened here? Okay, so they cut Medicaid close to $1 trillion over 10 years. So we're talking about 10% every year. So we're talking about $100 billion. And they've also cutting ACA. Some people are gonna get their Affordable Care Act marketplace insurance. The premiums are gonna go up, in some places up by 75%. And Medicaid cuts are going to happen. A lot of people don't realize this, but what happens is when you run a deficit, there is a law that kicks in. It's called the pay-go law that says if you run a deficit, you have to make up for it some other places. So, but the law says you can't touch Social Security and you can't touch Veterans Affairs, veterans benefits. So the only big one there is Medicare. So it's estimated about $500 billion going to be cut for Medicare. That's capped out at 4%. You think, oh, 4% is not bad. But yeah, the problem with the entire healthcare system right now, it was already, close to the cliff. And this is kind of the tipping point that's going to push a lot of think tanks, a lot of journalists, a lot of politicians, a lot of everybody thinks this is the tipping point that's going to push everything over. So let's talk about that today. So it's going to affect everybody out there. So these so-called, the targets of this, these lazy people that are receiving Medicaid. So they're carve-outs. So if you're receiving Medicaid and you're on SSI, Supplemental Security Income from Social Security, if you're on SSDI, Social Security Disability Insurance from Social Security, if you're taking care of a child under the age of 14, if you're elderly, 65 and older, those are basically most of the carve-outs there. So that means those people aren't going to get their Medicaid cut directly from this big, beautiful bill. It's only for those people between 18 and 64, and actually the expansion states. There's about 40 expansion states. There's other 9 or 10 states that it doesn't affect because they never gave those people that health insurance, okay? So if you look at all the numbers, and of that group of the people that are not working, because most of those people are already working, only a very, very small percentage. So the target is only about 2% of all the people on Medicaid. All the people on Medicaid that this bill directly cuts off, about 2%. 2%, that's it. But it cuts $100 billion from the program. 10% of the program is being cut. And that math just doesn't math. So who's going to take the hit for the other 98%? Actually, it's 99% because the people 18 to 64 are usually younger and they don't use a lot of health care. So they're actually, even though they're only 10%, they probably only take 1% of the budget. But the budget's been cut back about $900 billion. They take 1% of that. So we're going to save $1 billion. Congratulations. But we're cutting $99 billion out of the system. So $99 billion is going to come out of the system for all the other people. So what happens when you kick millions of people off of Medicaid? We've already seen it. We've seen it reported throughout the country. Rural hospitals are already on the brink, and they say, "Hey, Medicaid money coming in. That's the only thing that's keeping our doors open. That's the only thing that's keeping the emergency room doors open. The only thing that's keeping OBGYN open. If you cut that Medicaid off, and people are still going to get sick, they're still going to get injured. So those millions of people that no longer have Medicaid, that no longer have the Affordable Care Act, are still going to get sick and injured. They're just going to go to the hospitals. The emergency room is going to be the new primary care physician, like it used to be. So this is where it affects everybody, even the billionaires. The billionaires have their own, their own concierge, doctors on call and stuff like that. But if they're skiing in Aspen with their other billionaire buddies and they, break a leg, they have to go to the local emergency room, and yeah, good luck there. So even they will be affected. So these rural hospitals, I've already talked, there's about 600, I've seen different numbers, anywhere from 600 to 900 hospitals throughout the country that are just on the brink financially, and this is going to put them over. There is a very, very small budget in the Affordable Care Act, or excuse me, in the One Big Beautiful Bill, because they realized rural hospitals are going to be hurt. So they added this at the last minute. They added a $50 billion slush fund in there, but yeah, that's not even enough. And, I'm sure it's going to go, I'm sure it's going to be effectively distributed, right? So this is going to cost increased medical costs for everybody. And this has already been proven. Texas, who did not expand Medicaid, there's 8 other states that didn't expand Medicaid. Wisconsin is a weird situation. They didn't expand, but they've got their own system. But anyway, there's 9 different states that didn't expand Medicaid, and so there's millions of people in those particular states that don't have health insurance, and they go to the emergency room and they just wait for their illness or whatever, their injury to get worse, and it costs everybody a lot more money. So in Texas, on average, people in Texas pay about $1,200, $1,500 more per year because they have to pay for really expensive health care for these people that don't have health insurance that could have gone to a doctor sooner to take care of their issues, so it wouldn't have gotten worse and cost 10 times more, because emergency rooms cost so much more than anything else. So we are going to see states, the politicians that did this, they, were smart, and they said, hey, we're not gonna institute these things until after, we get reelected. So none of this stuff is supposedly federally not going to start until January 2027, but states have to balance their budget. In most states, it's part of the state constitution that the budget has to be balanced, and a lot of these states balance their budgets a year, 2 years ahead of the game. So we already see states already taking kind of a preemptive attack and saying, okay, hey, we're going to get a lot less Medicaid from the federal government next year, the year after. So we need to start kicking people off, making it more difficult, reducing these benefits, reducing networks. So if you're on Medicaid, if you have a hard time finding a doctor now, a hospital to go now, yeah, just wait. Services are going to be reduced. Drugs are going to cost you more money, all down the line. States are going to pinch pennies to try to reduce Medicaid because they just can't come up with that $100 billion, $99 billion difference. And we're going to see them, what's called bureaucratic disenrollment, where they're going to be, not technically kicking you off, but they're going to make it so difficult for you to continue to get your health care that you're just going to fall through the cracks, and they're going to kick you off. And then what happens is politicians are going to come in and it says, hey, we kicked off millions of, these lazy gamers, these 26-year-old gamers. We kicked off millions of these people, and we've saved so much money, so let's cut the budget again. And then they make, which it wasn't the gamers, it was just people that fell through the cracks, and their applications or their recertifications for Medicaid were denied. This happened. If you disagree, again, prove me wrong on any of these. Please, please, please. In your comments, provide me the documentation, the source. But after the great unwinding after the pandemic, Medicaid throughout the country, they cut off probably about 69% of people that were actually eligible for Medicaid, but because of bureaucratic snafus and the fact that Medicaid offices throughout the country don't have, staff to process these claims, people were kicked off incorrectly. And what's going to happen is people are going to be kicked off incorrectly, and then the politicians, the federal politicians, are going to say, "Oh, look at all these people that went back to work. I guess they went back to work." Somehow they disappeared. So I guess we can cut the Medicaid budget even more. So let's get into live Q&A right now. And see what kind of questions y'all have about all things. Someone talked about, let's see, waste of money checking people. Waste of money checking people, they just put their money in someone else's name. Okay, so this is about a thing that went out incorrectly. I did a video on this a couple of days ago. But the Social Security Administration came out with this emergency message that said they're going to start checking people's bank accounts. And they've been doing this since 2011. It's called EAFI, and it's for people on SSI. That's it. Supplemental Security Income. SSI is not Social Security. It's not Social Security retirement or Social Security disability insurance, or not spouse benefits or survivor benefits. SSI is SSI. It's a welfare-based program the Social Security administers. And as part of being a welfare, you have to have limited income, limited resources. They've been doing this since 2011. And they just changed it. Before there was a $400 threshold. They just said, no, there's no more fresh threshold. From now on, we're going to check everybody's bank account that is receiving these welfare benefits. And yes, that's how it should be. So somebody out there in social media land took it and went way, way out into the left field. And said everybody's Social Security is going to be looking at everybody's bank account in the future. No. I mean, I guess the IRS already does that. So, but that emergency message that went out has nothing to do with any of that. So, consider redirecting the war and destruction budget to the benefit of citizens and harm reduction to the rest of the world. Yes, yes. I've always said they should rename the Social Security Administration, because if you look at history, how countries get invaded and taken over is first they kind of decay from the inside. So I always say the Department of Defense defending ourselves from the rest of the world is making a strong country. So Social Security, I think, is our, being an old Marine Corps sergeant as well. I think if we're strong on the inside, then ain't nobody going to mess with us. And it's just not about, building up a bunch of weapons. So when you take Social Security, and if you're still working, you don't have to enroll in Medicare, right? I am working for the federal government. That is correct. If you're still working and still have, if you have health insurance from current work, then yes, you do not have to sign up for Medicare Part A, Part B, C, D, whatever, once you turn 65. But it has to be through current work, and your employer has to have 20 or more employees through your current work or your spouse's current work. You might want to consider signing up for Part A, since it's zero premium anyway, and it might give you a little bit of benefit if you ever go in the hospital. A lot of people do that. So they just sign up for Part A, refuse Part B, refuse the money because they're working, and then later when you stop working, you have 8 months to sign up for Part B, and there's no penalty whatsoever. And if you go onto my website, I've got all of those details there. Completely free website. You go onto Medicare section there, and you click on enrollment periods, and it has the initial enrollment period, and it also has what you're looking at, which is the special enrollment period. And I've even got the forms that you will need. So everything is there. It's 100% free. Let's see. The best physicians and surgeons will just go to private pay. My spouse lost a great orthopedic surgeon because he went private practice, which means does not take any kind of insurance. Yes, we see a national trend of that. So the people that can afford it, yeah, they're paying more. They don't have the health insurance and all the rest of it. And yeah, a lot of doctors are just completely fed up with the entire system. So we definitely need to do something.